in now. We're good to go.
Thank you. I will call the meeting to order. Can we take the roll call, please?
Better unmute myself. I see all members of the committee here. Chair Burley.
Thank you. And you can declare a declaration of community interest anytime you see fit during the meeting. Welcome, Warden. I'll move on to the agenda. We're down to our reports. Rockwood Terrace operating report. It was moved by Councillor Woodbury, second by Councillor Robson to put it on the floor. And Karen, I believe we'll turn it over to you.
Thank you, Mr. Chair. I'm just trying to get out of my full screen here so I can see the report. There we go. All right. Some of the stuff when I was writing it, so much has happened. It feels like it happened so long ago. So it was a good refresher. Anyway, the first page there is our quality indicators. As you can see by the colors, we're doing well as or better than provincial average in everything but wounds. We continue to work very hard on this area, and you may recall with the budget passing, we got an extra day a week for our wound care nurse. So we're hoping this will help us in the endeavor. The ministry has not been in the homes or in our home for the duration of this report. However, they have been in contact to offer support and information. And even over the weekend, we get an email on the Friday night to say you can reach someone should you need someone over the weekend. So that's been good. People-wise, I just wanted to put a shout out there to the entire team at Rockwood because everyone has really pulled together to move to room service, which we did back on April 6th. At mealtimes, it's all hands on deck and everybody has been very good without complaint to be there ready to support our residents. So I just wanted to give a shout out to everybody. Projects and location events are all listed there. I won't go into each one, but you can see we had lots of things happening right up until Tuesday, March the 12th, when life, as Terry wrote it, drastically changed. So nowadays it's all electronic, phone calls, FaceTime, Skype. Over the past week and a half or so, we started window visits again. So everybody was kept very busy on the weekend between handing out things that have been dropped off for Mother's Day and arranging these visits. The visits have been very well received for the phone calls. So that's been great. Families are very appreciative. We are very fortunate to have a musician on our program staff, Kara Smith, who is actually in the process or has released a CD. So she's very good and the residents really love it when she brings her guitar and walks the halls. We also had the Bunny come just prior to Easter, so that was good. Occupancy, as you can see, remains quite high. There was just prior to the shutdown an inspector from Public Health who attended the care community and inspected the main production kitchen. There were no violations as a result of his visit. Annual testing of the fire alarm system was held in February. Fire drills were held on 2 shifts only in March. Unfortunately, we missed getting the evening shift done with everything going on, but we did better in April. We are currently renewing mass fit testing for all our team members and have everyone done now but a small handful. Several interventions were put in place related to COVID-19, and I think there's a separate report about that, so I won't go into that. During the period, we did receive a written complaint related to the fact that the Saugeen Suite, which is our palliative care room, but is also used for various reasons throughout the year, was in use when a resident was palliative and therefore not available for their family member. We did provide a written response, and we have had a meeting, Jen and I set up with this family member, I think since March, and we've had to postpone it a few times because of COVID, but we do have it set up again for early June. We did offer a virtual meeting or a teleconference for this family member, but they chose to wait in hopes to meet face to face. As far as compliments and color, we really have been overwhelmed with the support and kindness received from family members, community at large during this time. It's just, people think of things that I would never think of to do, between sending food, paying restaurants to send food. We've received flowers, we've received hand sanitizer, we received an iPad, many cards and phone calls, and everybody's very appreciative. There have been no resident or family council meetings during the reporting period. And that's it, unless there are any questions.
Thanks, Karen. Does the committee have any questions? I think maybe I'll just back up a wee bit. It'd be appropriate if I read the motion first. That LTCD CM 1220 Rockwood Terrace operating report to the Committee of Management for the period of February 15th, 2019, April 14th, 2020 be received for information. Since there's no questions on the report,
Just a quick question, Mr. Chair. Can I have a quick question?
Go ahead, Mr. Warden.
So it's sort of outside your report, but I guess in general, Karen, with regards to the good news that we have secured a location for the new Rockwood Terrace, I don't know if that's inspired some positiveness in the facility, or maybe Jennifer. I know it's good news that we're moving forward. I just wondered if that has, made a smile on people's faces.
If I may, Mr. Chair, it certainly was a bright light that came at a very opportune time. So yes, it has sparked conversation again, conversation other than COVID. So great. And I think people were pleased to find out it's going to be an adjacent property. Mostly because they think they can keep an eye on the proceedings, I think, from where we sit. So yeah, it was very well received.
Thanks for that,
So,
Mr. Warden.
just to follow up, Mr. Chair, so they can be the armchair contractors.
Yes, exactly.
That's great. That's good. Thank you.
Thanks, Karen. What I'm going to do, I'm going to ask for a show of hands for those in favor of the motion before us. All in favor? I see, okay. Thanks, Karen. So I'm going to move on with our next report. That LTCM CRCM 1320 Grey Gables operating report to the Committee of Management for the period of February 15th, 2019, April 14th, 2020 be received for information. It was moved by Councillor O'Leary, second by Councillor McKay. And I'll turn it over to Shannon.
Thank you, Mr. Chair. So the first is the quality report, or quality indicators. As you can see, we are better, or mostly better than the Ontario average, but we are working on our worsening behavior symptoms and the worsening mood from symptoms of depression. So those are the two that we are mostly working on. For ministry visits, we haven't had anybody in-house, but we do have weekly operating reports that they check in on us. And I did ask her about the director's referral, and that is going to be held off until after COVID is over and that they are able to get their feet under them, I guess, as well. As for outbreaks, during this reporting period, we did have an enteric outbreak of 2 residents and 2 staff, but nobody was hospitalized and there was no deaths. And that was cleared before everything else changed. Under people, Grey Gables did attend 2 of the job fairs that happened in Hanover and in Owen Sound in February. We did get lots of people attended, but there wasn't many PSW applications, or there wasn't too much potential there yet. But we have since then been able to hire some employees, so that's been good. Crystal McKay was offered the position of the PSW coordinator that she took. She has been at Grey Gables for many years as a nurse and also as our RI coordinator. So with her taking that position, we are going to now be hiring for a RI MDS coordinator. Crystal and Kim Mustard have been training redeployed staff. So at our facility, we have trained over 60 county employees to be redeployed if needed for COVID, if it happens. Yeah, Grey Gables is very thankful for the redeployed staff that we've had. They've been excellent. They've been doing a lot of our screening at our doors. They've also been helping with one-on-one visits and helping set tables at sometimes, helping in laundry. They've been very, very good and helpful. From the community, we have also received many donations. Our main ones, like big ones, but not our main, Bruce Power, Chapman's, and Markdale Hospital have given bigger donations, as in like iPads and food and PPE. But we've had community, lots of acts of kindness with cards and pictures and flowers being dropped off, just really, and a lot of the scrub, I guess they're called scrub caps, with the buttons on the side so that it helps when you're wearing a mask to relieve the pressure of your ears. So everybody has been very thankful for those. Under projects, so in February, we had the annual pancake luncheon for Shrove Tuesday, where management had cooked all the pancakes. And then in March, we started the Color It Connect program, which is allowing the residents and families to connect using technology, which has gone over really, really well. And actually just over Mother's Day, sorry, just over Mother's Day, the residents were actually saying that it was much nicer to be able to connect one-on-one than having a group program. So that was really nice to hear. So all the ladies got to connect with their families on that day. We've also had, we had Easter as well, which they did the Color Connect program with them as well. Spiritually, we've had, that's been happening over FaceTime, as well as our social worker has been coming in and doing counseling as well that way. Sorry, not coming in, but doing it over FaceTime. And families are very much appreciative of everything that we are doing at Grey Gables as well. Occupancy, so we are full. We did receive 2 more temporary beds as well. We are at 68 instead of 66. And they are going over well. We also have made some environmental changes with our home and added isolation rooms. So 1 more room on every wing, so that if needed, when we have been using them for admissions into the home, or if somebody has been swabbed, they're being moved into these isolation rooms until we hear back the results. So Under environmental, we have had our code reds, and we also did a code blue in April, where we had a staff member pretend to have a medical condition. And that went over really well. We've had our hot water replacement for a capital project. And then, yeah, on March 13th, everything really changed within the home, but we've done a lot of isolating and social distancing and trying to keep our residents safe and our staff safe. Yeah, so we haven't had any visitors into the home. I shouldn't say, we did have 2 essential visitors come in when we had 2 residents that were palliative. They were able to come in on full PPE, but just 1 person for the family or out of the family. And then our leadership team has also been divided into 2. So only half of the leadership team is in the home at one time, which helps keep everybody hopefully safe. We haven't had any written complaints in this reporting period. And Color It Story back, it seems like a while ago now, but back in February, we had the snowstorm, which closed down our roads. And we did have a family that was stranded, so we let them stay in the home, in our front entrance or front vestibule there, not vestibule, lounge. And they were very helpful and very appreciative of the what we do. And they actually were helping out. They did, helped played some bingo, and they helped set some tables and shoveled some snow for us. So that was very nice. And they were very much appreciative of us letting them stay. Yeah, so we had, oh, I should have said, I might have missed something. Back in people, when this COVID started, we did have 1 employee who has refused work because of, she didn't feel safe, but we talked to the ministry, we've talked to everybody, and they've agreed that we've done everything that we needed to do, but that she has still remained off. So, but, and then under family council, we did have 1 meeting, and John was attending it, and he showed them the new tub room that was completed. And other than that, everything else has been closed. So, thank you.
Thanks, Shannon. Does the committee have any questions? Seeing none, everybody's smiling. All in favor of the report, the motion? It's carried. So we'll move on for our next report. That LTCR CM 1420 Lean Manor Operation Report to the Committee of the Management for the period of February 15th, 2019, April 14th, 2020. Be received for information. The motion was moved by Councillor Klumpus, second by Councillor Leary. And I'll turn it over to Renee.
Thank you, Mr. Chair. For our quality indicators, we are better than provincial average, except for 1 area, which is worsening activities of daily living. We continue to focus on worsening mood and skin and wound and depression. We are working with our skin and wound nurse, and she has been very effective in keeping our skin care and stage 2 to 4 ulcers under control. We did not have a ministry visit during this report, although we all have weekly updates with the ministry, and they offer support during this time. We did have 2 outbreaks. We did have several outbreaks actually for influenza A and an enteric outbreak. There were no deaths with these outbreaks. It affected both the residents and the staff. We are pleased to announce that Paige Caswell is our new nutrition manager effective March 16th. She started at the beginning of COVID and she has risen to the occasion and jumped right in there and has made sure that dietary and nutrition is well looked after during this time. We are also very thankful for the redeployed staff. We have redeployed staff working with us in activation in the Color Connect program. We also have one redeployed staff member doing as an emergency support worker, one in the kitchen, and one person in dietary. And we are very, in the office, we are very, very thankful for their support. They also are our screeners for us. So I'm not sure what we would have done without them. They have been incredibly helpful to us. Well, again, it seems like a long time ago, but in February with the snowstorm, that was the talk of the day with the major blizzard that happened. And then with the fire down in Australia, the residents made pouches for the baby kangaroos, and then life changed. And there were many things that we put into place to assist the residents during this time. We do hallway bingo. We've done activity bingo. Bingo cannot be stopped even during COVID. We have staff challenges that include the residents. So we've had cowboy days. We've had karaoke days in the hallway. We've done neighborhood time. We stopped social programs or group programs, and we do neighborhood time, and the residents receive one-to-one visits from the recreation staff. We've done we sing O Canada every Sunday at noon. The residents and the staff are encouraged to wear red, and we stop for a moment to sing O Canada. We are taking many pictures during this time, and we've put together some iMovies and some posters with the activities that have been happening throughout the home. Our occupancy is at 99% year to date, and we also have one additional temporary licensed bed, so we are at 151. We had, for stakeholders, we had the Electrical Safety Authority in and audited our logbook, and there were no defects. We are running paper code red drills through these last few months. And there is a report on all the things that we have done for pandemic. We have received also incredible community support and food from local restaurants. We have also received an iPad and donations from Bruce Power. Our families drop off cards and flowers. We created a Color It compliments board in the main lobby for all the staff to see, where we post the cards and all the compliments that we're receiving. We also had the emergency services do a drive-by, and that was quite overwhelming to see the police and EMS and the fire trucks drive through our parking lot and give support to the residents and the staff. And yeah, are there any questions?
Thanks, Renee. Does the committee have any questions? Councillor Mackey.
Thanks, Mr. Chair. Just a comment for all three executive directors and our three homes. The performance indicators, it's really nice to see the work that everyone's done and the improvements in the performance indicators. So, thanks to everyone for addressing those issues, and it's nice to be above the provincial standards.
Thanks, Scott. Is there any other questions? Councillor Klumpus? You're muted.
There I am. I just wanted to follow up with that. You know, in these days of what everybody is going through, and the notice that our particular hotspots and areas of worry are long-term care homes, it must be that much more of a stress and strain on staff to keep spirits up and to provide the services that are needed for these residents. And I just want to offer my congratulations again. Reading these reports, it's very obvious the quality of staff that we have in place and the efforts that are being made to make life as normal and as easy as possible for these residents, particularly at this very hard time. And I can well imagine going home. We were talking about at the end of the week and the end of the day, we're all feeling absolutely exhausted, but that must happen every day for you folks in the long-term care situation, because it seems the pressure to keep spirits up and to be up yourself and just to maintain a normalcy as much as possible has to be a terrific strain. So thank you and congratulations.
Thanks, Barb. Before I ask the vote, I'd like to put a question out to the three directors and Jennifer, I guess. I often wonder about the flu epidemic that usually comes into homes sometimes and so on with the COVID. How do you separate the two? That must make it very, very hard.
Renata, would you, as a nurse?
The nurse? Well, we did screen for influenza, and we are swabbing for COVID at the first sign of anything, any sniffle, etc. The influenza was prior to the COVID, and since then we haven't had an influenza A case or any other respiratory type virus that has showed up. All of our swabs to date have been negative. And I meant to mention that yesterday, Lee Manor was swabbed, all the residents and the staff. So we did over 330 swabs yesterday.
And I'll just add, Mr. Chair, that when we notice any sort of symptom, we do that isolation and we do a test. And the test will test for COVID as well as other respiratory infections. So we're able to then have a better idea of what it might be. And sometimes we know it's not COVID and we know it's not influenza, but it's some other respiratory something, and we isolate and provide care for those symptoms.
Thanks, Jennifer.
Mr. Chair?
Go ahead, Christine.
Thank you, and through you. One of the reasons that I didn't have a question this time around is because obviously, like the rest of the committee, I'm paying attention to the performance level of each of the homes, and it's exceptional, extremely well done to each of you as our executive directors and to your staff. So there was no question that I had, but I do want to comment as well, as Mayor Clumpus did and Mayor Mackey, and that is that the compassion and the quality of service that you and your staff provide is absolutely outstanding, and it certainly is amplified during this pandemic. So thank you very, very much to each and every one of you. You have put the support in, you've shown the leadership for your staff, and it's just wonderful to see, and thank you so much.
Thanks, Christine. Great words, and I echo the same comments. Very good. I'll ask for a vote on the motion before us, please. All in favor? It is carried. So moving off our agenda, we're down to 1620 long-term care. That report LTCRCM 1620 regarding the long-term care COVID-19 status update be received for information. It was moved by Councillor Mackey, second by Councillor Woodbury to put it on the floor. And Jennifer, are you going to do this report?
I am. Thank you, Mr. Chair. So I'm just going to highlight from the executive summary and then see if there's any questions. So the testing numbers regionally have increased, and as Renata mentioned, the homes are being universally tested. So yesterday it was Lee Manor, tomorrow is Grey Gables and Rockwood Terrace. Yeah, tomorrow is Grey Gables and Rockwood Terrace. So even though the testing numbers have universally increased, we continue to not have any COVID-19 cases or outbreaks in any of our 3 homes. I'm echoing in the executive summary what I've heard you say, that the staff's compassion, positive attitudes have assisted our residents during this time. The departments are working together, the teams in the homes are working together, the teams across the 3 homes are working together. We continue to do a daily check-in by Zoom with all 3 leadership teams on the call every day, finding out what are the newest updates, what's some success stories, what are the challenges, and sharing that across all 3 homes. The EDs highlighted the community's support and rallying. And I highlighted also the partnerships. So the partnerships, not just within our own organization, so the support from the CAO, the senior management team, other the redeployed staff, but then also the partnerships across the sector. So the hospitals have partnered with the long-term care sector. I was invited and I brought along a director of care to a call last week where the Grey Bruce Health Services had 60 staff on the line who had put their hands up to say they would volunteer to be redeployed as a crisis response team into a long-term care home in Grey Bruce if it was needed. And so they had 60 hospital staff on the line, and they invited Cynthia and I to come and give a highlight about long-term care, and then did a question and answer. And these are the kind of partnerships that are going to make our health system in Grey Bruce and provincially that much more stronger, responsive to the resident, patient, client, citizens' needs. The partnerships have been incredible. So in the body of the report, there's a lot of information about the other initiatives that we continue to update and sustain, and I'm happy to answer any questions.
Thanks, Jennifer.
Questions.
Great report. Questions from the committee. Councillor Leary.
Thank you, Mr. Chair. Jennifer, I've talked before about my time at Lee Manor, probably going to Lee Manor every day for a year or so. Never once did I always talked about the best part was of Lee Manor was the staff, but never once did I see a PSW treat my mother with anything other than perfect professionalism. And I was a little bit thrown off guard here to see that there's been a couple with misconducts and disciplinary action taken. Is that uncharacteristic as a whole, or is it related to the extra stress they're under, or is this just isolated?
So I'm just wondering if, is this part of the closed?
Yes, yes, it is. So
report?
this will be
And so
discussed under
maybe-
the closed report.
Okay. Sorry, I apologize for that.
That's okay.
The other
Can
thing I
I
wanted to
just-
ask about was, yep.
Just to say, because we are in open session here, just to say that like any workplace, and especially one that delivers, face-to-face personal care, we are held to an extremely high standard, and we take these situations, every single one of them, very, very. So I would want anyone who was watching this broadcast to know that we leave no stone unturned when it comes to dealing with these things, and we'll provide the committee with some additional detail when we go into the closed session. But we don't have an issue here, and I would want everyone to feel that.
Thanks, Kim.
Okay, thanks. I apologize, Mr. Chair. I just wrote a couple of things down and I completely forgot. So just to make sure I'm not going on the wrong road again, I also wanted to talk about compliance orders with the Ministry of Long-Term Care inspector that was on site for Grey Gables. Can I talk about that now or later?
I'm just
Heather,
Jen, is that
It's
part
not,
of the,
it's not a result, like I was just looking at the date. So the inspector came to Grey Gables for 2 days, February 11th and 12th, 2020. And it was just a follow-up meeting from the previous order on the 14th of June, 2019. So I think it should be okay to talk about that. I'm just wondering about the timing of that. So like that's 8 months later. So there was on the 14th of June in 2019, and the inspector doesn't come back for a follow-up until 8 months later. Is that normal?
Jennifer?
Well, sorry, thank you, Mr. Chair. So it depends very much on what the compliance deadline date is for putting in initiatives to resolve the order. And so this order is related to 24/7 registered nurse coverage. And if I'll just remind the committee that under the current legislation, even having an agency RN does not meet the compliance. So they gave us a very long deadline to continue to implement our strategies to hire our own registered nurses. We have hired and successfully recruited some registered nurses, but not until after they had returned in June to do that follow-up. So that's why they left. They came shortly after the deadline for having 24/7 RN coverage. When they arrived, though, we were continuing to use agency RN to fill the gaps from our own registered nursing complement.
Okay, so the 8 months was to your benefit then, correct?
Yeah.
Okay,
That's correct.
so that's really what I'm trying to find out, whether it's because then the follow-up didn't come until February 18th of 2020. So that's when you got the report. So that's not a benefit to you, I'm sure, but is that normal? Like that's a
So
long time too, from June.
Yeah, and I can't speak specifically to the strategy of the province, although I can say that there has been, prior to COVID, there has been initiatives to have inspectors return in a more timely manner and respond in a more timely manner to complaints, concerns, inspections, follow-ups. So that was starting to happen, and then COVID-19 happened, and the world looks slightly different now, and we'll see what a new normal looks like after. But our experience has been both that the inspectors have returned there in a timely manner, and then other incidents we've had where it's been many, many months before they were back at the home to do a follow-up.
Okay, so I'll tell you where I'm going with this. I'm just looking, I just wanted to ask you, Jennifer, if there's a list that you're keeping of deficiencies, and if that's a deficiency of, inspectors being late or taking a long time to get reports through, I'm just wondering if we shouldn't have some kind of a list and kind of document things as we go along here, because I think one of the positive things out of this whole COVID thing is our provincial government has been smacked right in the middle of their forehead. And they're realizing now that their treatment towards long-term care has been below average. And I think we have to, at some point, we're going to have to be prepared to send a stern message to our government that we need some things changed. And certainly on the money side of it, and maybe Kim, you can speak to that, because if we start lobbying the government for more money towards long-term care, which we should be, because it's healthcare, and we should not be paying what we're paying for healthcare. But timing is everything, and I'm not sure if when we're in the middle of a renovation and getting money from the government, now is not likely the time for lobbying for more money. But I'm just wondering if there's been a discussion because I think the government's been open. Well, all the municipalities are open towards, our long-term care. They're suffering in something like this. So there's certainly deficiencies, and I think the government's starting to recognize it. And I think we have to be prepared to send them a list or a message of things that we need to be active on.
Kim?
Thanks for that question. And through you, Mr. Chair, I can say that Grey County has delegated on long-term care at almost every AMO meeting since I've been here. And so over the past 5 years. And Western Ontario Wardens Caucus, so on behalf of all of the 18 upper tier municipalities who all have long-term care responsibilities, we've also, as part of our briefing documents back to the province, have flagged, a number of issues to the province that we'd like to see them pay attention to. I will have a redevelopment update for you shortly on this agenda, and to speak to some of the more recent conversations that we're putting together to have with the province as well. So absolutely, it's something that we have been doing and something that we will continue to push for, to ensure that there's a really solid understanding of some of the challenges that we face.
Great, thank you.
Thanks, Kim.
And if I might, Mr. Chair.
Go ahead, Jennifer.
I'll just add that we're active members of Advantage Ontario, which is the association that we belong to, and they play a very active role in advocacy for long-term care on many areas. So I know that they have been sitting at the table with the province, advocating for a variety of initiatives specific to COVID and then outside of COVID as well. And they've been doing that quite successfully. So we can keep this committee up to date on those initiatives as well.
Right, and I think just to follow up, one of the things I wanted to mention too is I think we're all finding out during this COVID experience, our PSWs don't make enough money, which is something else that we're going to have to address at some point, and that's looking for more money from the government to make up for that. But anyway, that's for a day down the road. Thank you, Mr. Chair.
Mr. Chair.
Go ahead, Mr. Warden.
Thank you. And this is sort of a high level, and I certainly hear that the comments that Councillor Larry is referring to. And I think through this whole COVID-19, we've really understood a lot more about PSWs and about being in one location and frontline, and there's a number of conversations that have happened and have been discussed in a sense of we think that they're maybe should be elevated to a higher level. And I think there's going to be a lot of conversation coming out of this as COVID-19. I will say, just from a high level, from conversations that I've had, I know that the provincial government was working on the recommendations that came out of the Wetlaufer inquiry, and there's a lot of moving forward parts that they were in the process, and then COVID-19 hit, and then, as we all know, governments have been certainly preoccupied with dealing with this. And moving forward, I think I will comfortably say that there will be some changes coming. I know the provincial government is working on moving forward with that at the very preliminary stage. I will say that myself and the CAO and a municipal or a provincial representative have had a conversation about a few things that I can't really share at this point, but I know there's a lot of things, a lot of moving parts. And I think I would suggest that we don't want to get too negative, but keep it positive of looking forward of what can be a positive move forward with PSWs in our homes and the provincial guidance and guidelines with regards to long-term care. So I certainly echo your comments, Councillor Leary, and I think others have had those same comments, that we realize that PSWs, the frontline workers, there needs to be a bit of maybe a reset button on that. But I think at this time, certainly continue to have those conversations, but I think that moving forward, there will be some provincial guidelines and directive and discussions that will carry on out of this pre or post COVID-19, whenever that is. But certainly, there is certainly a feeling that there maybe needs to be a bit of a reset button there. So I just caution on the side of being too critical, but certainly being suggestive in the sense that changes do need to be made. But we want to be part of that, working forward in the sense of moving toward a new model and new direction. So I'll leave it at that, Mr. Chair.
Thanks, Mr. Warden. Just a blanket statement for me, my own personal views is that once a pandemic is over, the way long-term care business is being done in the province, I think it's going to be a completely different way of doing business. I really feel that there's just many things we've learned from this, and even the way we make new homes, I think it's going to be a completely different way of doing things. That's just my own personal opinion.
Mr. Chair, if I might.
Go ahead, Christine.
Thank you very much. And through you, Jennifer, I just want to acknowledge the detailed work you've done on this report. And specifically, I'd like your attention on page 25. You talk about going forward, we'll continue to work on new strategies, implement outbreak protocols, manage and monitor PPE supplies, and ensure ongoing communications with residents, families, staff, and community. That really intrigues me. And I was wondering, first off, when that report would come forward, because I really think it will chart the course and the direction of how we're managing long-term care. So most interested, certainly going through COVID, that will make some changes. Part one to my question. Part two is I was wondering, within our operational or the operational reports that our executive directors provide, is there an opportunity to include a section? And I'm wondering if this needs to be through the province, or if this is something that you can achieve as director of long-term care. Within those operational reports, could we also include a section on outbreak protocols? And so that we would be able to manage and gauge the performance of how we're dealing with them within each home.
Jennifer, any comments?
Okay, thank you. What I can say is that right now there's a lot of moving parts, and we're expecting some guidance from public health, from the province, and then regionally, we're actively working on preparing some guiding principles for what kind of a phased in approach of opening up long-term care might look like. And so those pieces need to align and come together. I think that we can add whatever to the report, whatever is necessary for making sure that this committee is up to date. We did include in these reports, the open session reports, some information about outbreak. And I think that as we come to learn what those strategies of a new normal are going to look like, I will definitely be bringing those to committee for discussion and input. And at this time, we're just working through what a new normal is going to look like.
Thanks. Thanks, Jennifer. Councilor Leary.
Mr. Chair, your comments just remind me of something I wanted to ask him about. Where are we at in terms of the design of the new builds with Rockwood and Grey Gables?
I wonder, Councilor Leary, if we might pick that up a little further on our agenda under redevelopment.
Okay.
Okay. Councilor Mackey.
Thanks, Mr. Warden, or sorry, Mr. Chair. I just want to, comment on Councilor Leary's remarks. Certainly the deficiencies in long-term care have been exposed now, and members of this committee have been aware about the staffing shortages and the number of hours, or the too infrequent hours that our staff have to provide care. I think going forward, this is going to be a tremendous opportunity. I think the public now understands and sees, these deficiencies. So it's terrible. It takes a tragedy like we've seen in our long-term care to invoke change, but that's too often the case. So I am optimistic, but I think we do need to, collectively, advocate, for these changes. This is the time to strike within the next few months. So I'm really happy to hear that, Jennifer and Advantage Ontario is putting together a list of what they'd like to see happen. I have a question. The province certainly did for all of our essential service workers have indicated that there's going to be a $4 an hour increase, I believe, for the next 4 months. Have we as a county received any information, and when do we think that would be implemented?
Okay, I guess Jennifer, do you comment?
Sure, thank you, Mr. Chair. So that announcement was made a couple of weeks ago, and information is about that and is trickling in. So we have not yet got the full picture from the province on how that pandemic pay works. We're committed to making sure that all the folks that are eligible for it are getting it. We're tracking it appropriately so that we can do the reporting mechanisms back. We just don't have any of a full picture of what that looks like from the province at this point.
Mr. Chair, if I may, Jennifer, do you, our staff that from other departments that stepped up to help in our long-term care, will they be eligible for this increase?
So do you mean internal in the long-term care homes, other departments, or outside of long-term?
So our staff from the outside departments that have went and have done the screening and helped in the laundry and things like that we've heard of, will they be eligible for the $4 an hour pay increase?
So based on what we know,
Yeah.
they do not meet the eligibility. Sorry, go ahead, Kim.
No, that's right. You're fine. Go ahead.
Okay, just based on what we know at this point, they do not meet that eligibility criteria.
Well, that's
Thanks,
too
Jeff.
bad for the people that went above and beyond, but thank you.
Okay. If there's no other questions on the motion before us, I'll ask for a vote. All in favor of the motion? I believe that is carried. So we're going to move on with our agenda. We're now going to go into closed session. I'll read the motion. That the Long-Term Care Committee of Management does now go to closed session current to section 239(2) of the Municipal Act 2001 as amended to 1, to discuss 1, personal matters about identifiable individual, including municipal employees, operation report, and 2, labor relations and employee negotiation operating report. It was moved by Council Robinson, second by Council Mackey, that we would go in closed session. All in favor to go in closed session? Thank you, Rob.